Hey guys, welcome back again to my channel. My name is Incase. If it's your first time stopping by, then you baby are most definitely welcome. Now in today's video, I'm going to be talking about an overview of the Plab 2 exam and how to pass the Plab 2 exam. I recently started a Plab series because if you don't know, I recently moved into the UK as an international medical graduate, and I'm aware that a few people are interested in doing this because a few medical doctors and medical students are following me. So I wanted you to have the blueprint on how I did it so that it just makes your life so much easier. Now if that sounds like something that you'd be interested in, then please keep on watching. If you haven't seen my Plab 1 video, it's going to be linked up in the cards just in case you haven't taken the exam or you know someone who is looking forward to taking the Plab 1 exam. Great, now without further ado, let's jump right into the video. The first thing you need to know about the Plab exam and the Plab 2 exam really is that's a little bit more complex than the Plab 1 exam in the fact that number one, the Plab 1 exam tests basically your theoretical skills, and the Plab 2 exam tests your practical skills, which is your history taking, physical examination, and communication skills. Communication skills is a very huge part of Plab 2 exam. So if you're taking the Plab 2 exam, I would personally suggest that you dwell a lot on your communication skills, because as opposed to the Plab 1 exam, it is already assumed that you have the basic knowledge in terms of history taking and physical examination, because again, you went to a good enough medical school, so you shouldn't struggle too much in that regard. But they want to see how you are able to talk to your patient, talk to the patient's relatives, and pass information across in a way that the patient can understand. I hope that makes sense to you. That is one thing. So because again of this, I would suggest that the wait time between your Plab 1 exam and your Plab 2 exam is not too long, so that your clinical skills are still fresh. If for whatever reason it is still long, I hope that you are able to, work and practice so that every day in your day-to-day lives you are refreshing your clinical skills. I, for example, had a very long wait of almost 2 years because of COVID, and just for some other reasons here and there, I wasn't able to take my Plab 2 earlier. But because I was actively practicing at the time, I didn't struggle too much with my clinical skills as opposed to if I was not in clinical practice at the time. I hope that makes sense to you. Great. So what we're going to do is this video is going to be divided into the general overview of the Plab exam, which is how long it takes and all of that, and the reasons why people fail exams, how to actually prepare for the exams, and if you need to attend an academy. So the Plab 2 exam is typically 3 hours and 10 minutes, typically, and it is usually 18 stations and 2 rest stations. It is in the form of an OSCE exam. So I'm sure everyone who went to medical school already knows what an OSCE exam is. That is how the Plab exam is done. When I wrote my Plab exam sometime last year, and that was because of the whole COVID thing, it was reduced from 18 stations to 15 stations. So in my exam I had just 15 stations and 2 rest stations. I hope that makes sense to you. So I had a total of 17 stations as opposed to the typical 20 stations that you would have in the Plab exam. I'm not sure what the current situation is, but you need to be flexible just in case that they've increased the station or for whatever reason it's been reduced. You just need to keep your mind open and be flexible about it. Another thing that you should know is that each station typically lasts for around 8 minutes, and before you get into the cubicle where your examiner and your simulator would be, the exam question is usually outside the door, and you need to spend about 1 minute 30 seconds reading the exam question. The 1 minute 30 seconds is not included in the 8 minutes, which is for the exam itself. You just need to know that your exam question is literally in front of the door, 1 minute 30 seconds, and read that question, digest the question before you enter into the room and answer the question that you have been asked. Now let's move into why people fail the exam, because this is very important. People typically fail the exams because they don't understand the question for whatever reason, so they end up answering a totally different question from what was asked. That is number one recipe to fail the exam. So for example, if you go to a station and they tell you to break bad news, talk to this patient about the diagnosis of prostate cancer, and then you start clerking the patient, you haven't answered the question, so you are going to fail the station. I hope you understand what I mean. So it's very important for you to understand the question and answer what exactly was asked of you. Now, each station typically carries 12 marks, and there are 3 domains that make up the 12 marks. Each of the domains carries 4 marks respectively, so it's equally split amongst the domains. The first domain is data gathering skills, and your data gathering skills would be your history taking and all of that good stuff. The second domain would be your clinical skills. So your clinical skills would be the ability for you to formulate a plan and a working diagnosis. And the third domain would be your interpersonal skills. Your interpersonal skills would be your communication, how you smile, your body language, everything. So again, that is why I say that communication skills are very important, because if you nail the aspect of communication skills, you can literally already pass the exam. Because what are the odds if you get 4 in interpersonal skills? What are the odds that you can't get 2 in history and clinical skills? What are the odds that you can't get 2 in the other domains? And that already would typically put you at a pass mark. I hope you understand what I mean. So smiling, very important. Hello, my name is Dr. Femi Ewole. I'm one of the junior doctors in the practice. Could you please confirm your name for me? That is how you would talk to your patient. You won't go there and be frowning your face, because that's not what they want. Do you understand? If a patient tells you, oh, if the simulator tells you, oh, I'm so sad, and the simulator is crying, you won't now go there and still be clerking the patient. You would give the simulator a minute to cry. So you can see, I can see that you're very upset, and I'm sorry that you feel that way. Sympathize with the patient. These are the things that make up for the interpersonal skills. These little details here and there are the things that make the interpersonal skills. Now, the format of the exam will typically be clinical scenarios. Under clinical scenarios, we have things like history taking and examination stations. So there are some stations that your duty is practically to take history, come up with a plan and all of that. There are some stations that your duty is practically just to examine a mannequin, which it would typically be. So they might tell you, examine this gravid uterus and tell us about the lie and the position and blah 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 of the baby. So that would be, or examine breast examination, it would typically be a mannequin. Or testicular examination, it would typically be a mannequin. Or a prostate examination. So with a prostate examination, it is important that you talk to the mannequins. Even though it seems crazy, you have to talk to the mannequins like you are talking to a human being. I remember during one of my stations, it was a blood transfusion station, and the question said the patient had a blood transfusion reaction. Now there was a full mannequin there, and obviously it's not alive, but I just had to say, excuse me, Mr. Johnson, are you all right? Are you all right? Act like you're talking to a real human being. Do you understand what I mean? And do you feel better now when you do an intervention? Is this okay now? Do you know what I mean? So that it's mostly showmanship. Do you understand? When you perfect the act of showmanship, then it helps you score a much higher mark in your interpersonal skills. Then there are also communication skill stations. So with the communication skill station, then you have things like breaking bad news, or maybe a little underage girl comes to you in the practice to ask for contraceptive pills because she's had sexual intercourse with her teacher. How are you going to handle that situation? These are the things that you need to know. Or maybe someone a transgender person is trying to transition from male to female, and the person is underaged. How will you handle this situation? Those are typical scenarios that you can get under communication skills. The pass mark for the Plab exam is usually dependent on the general performance of the group of people that wrote the exam at that particular time. So in my time, I told you guys that it was 15 stations, 12 marks, so that was about 180 points, and the pass mark for my time was 100 over 180. So it's a fairly fair exam. It's not that difficult. And also there are two, apart from the typical pass mark, which would be over how many points, there's also a minimum number of stations that you need to pass. I remember when it was 18 stations. A friend wrote the exam and it was 18 stations. You needed to pass 12 out of the 18 stations to pass the exam, as well as pass 125 over 210 to pass the exam. So there are two different pass mark criteria. I hope that makes sense to you guys. If you guys don't understand anything at any point, please leave a question down in the comment section and I'll answer it as soon as I can. So again, the Plab exam is pretty expensive. It was £875 when I wrote it, but I gathered recently that this year it has been increased to £906. So it's an expensive exam and you want to make sure that you pass the exam in one go so that you don't have to write it multiple times, because it can get expensive pretty quickly if you're having to write it more than once. Do you know what I mean? Which is why adequate prep is very important. I would typically say that you need 4 to 6 weeks to prep. I was actively working in the emergency department when I decided to write my Plab 2 exams, so I couldn't have a break period for too long. I just took my annual leave, which was about 30 days, and that was what I used to prep. So I had just 4 weeks to prep for the Plab exam. You don't really need more than 4 to 6 weeks to prep for the Plab exam, if I'm being honest, as long as you're dedicating about 12 to 14 hours per day of active studying. Now, the Plab 2 exam is not the type of exam that you can write without a study partner. It's just not possible. You have to have a study partner with the Plab 2 exam, because you need to practice these clinical skills. You need to practice these interpersonal skills. You just need to practice it, because I know that it seems simple, or is it not just to say this and this, or is it not just to say this and it's always simple until you have to do it when you're in timed conditions or when you're under some pressure. So it's really, really important that you practice with a practice partner. If it's for Plab 1, you don't really need a study partner, but Plab 2 is an exam that you need an active study partner. You look into the mirror, you talk to yourself, you see your facial expressions. Are you smiling enough? Is your body language tensed? These are the things that you need to put into consideration when you're writing your Plab 2 exam. For possible questions, there's a link on the GMC website. I'm going to look for it and put it down in the description box of kind of questions that you can expect. For like the practical questions, you can expect things like maybe venipuncture, or how do you take sample for an arterial blood gas, or how do you catheterize a patient, urethral catheterization, stuff like that. That would typically be the scenarios that you would see for the practical stations. Or maybe teach this medical student how to do a subcutaneous injection, something like that, or teach this medical student how to sight a line, something like that. Do you understand what I mean? It can also be things like CPR, so there's a list on the GMC website. Really, I'll look for that list and put it down in the description box so that you guys know. If you want to prep on your own, I would say that Geeky Medics is a very good place to start. They have a YouTube channel, and that is where I sat down and I just watched a ton of their videos: fundoscopy examination, otoscopy examination, breast examination. You just watch the videos on Geeky Medics. Or if you're someone who likes to read through, you can also read through their website. Geeky Medics would tell you how it is expected of you to do these examinations in the United Kingdom, because there are slight variations here and there, and you just want to make sure that you're doing it according to how they would typically do it in the UK. Again, interpersonal skills again, so they may ask you to explain a new diagnosis to a patient, or break bad news, or maybe try to calm an angry relative. that is something that you have to practice with someone. So again, why a practice partner is very important. If you want to see, for example, sometimes they say explain a new diagnosis to a patient. Maybe tell this patient that the patient has prostate cancer. It is important that you don't use medical jargons when you're explaining a new diagnosis to a patient, because then you will be marked down. If you want to know how the NHS will typically explain new diagnosis to patients, you can check the NHS website for patients, or even patient info. Those are websites that you can get how to typically pass across a message to a patient in a layman language, so that the idea of the message is retained, but you are not using medical jargons to talk to the patient, because that can be counterproductive. Really, it can end up being more confusing for the patient. Sometimes you may be asked to examine a patient, like I said, clinical examination stations. So maybe prostate examination, testicular examination, breast, all of that. Again, Geeky Medics is a good place to start with things like that. You see, I've said Geeky Medics a few times. This video is not sponsored by Geeky Medics, by the way, but I truly believe that Geeky Medics is a very, very resourceful place. NHS websites, like you could just literally, but I'm not sure, but I think you need to be in the UK to have access to NHS websites. I'm not sure, but if you just Google maybe cervical spondylosis, for example, you just Google that and put NHS, cervical spondylosis NHS, the NHS page will come out, and then you can read how the NHS would typically describe this condition to a patient, so that you know the type of language to use when you're talking to patients. Because it's not about mentioning medical jargons. No one truly cares. If I'm being honest, no one cares. Does the patient understand what you're saying? Can they say it back to you? Is the information retained? That's the important thing, not whether you know the pathophysiology and all of that. No one actually cares. Okay, now the ultimate question: do you need to attend an academy? If you can afford it, I definitely would say that you should attend an academy. It makes your life so much more easier. I know people who wrote the Plab 2 exam without attending any academy, and they did well. But if you can afford it, please attend an academy. It just increases your chances of doing better, because one, you have the mannequin, and those are the type of mannequins that you will see in your exam. So if you get to practice with the mannequins ahead of time, then it makes it easier for you when you see those mannequins in your exam. Two, there are a lot of like-minded people beside you. You're studying for the exam all at the same time, so you have automatic study partners. Three, sometimes they have past questions that they revise with, and those past questions are really, really helpful, because they sometimes come out in the exams. So if you have done all of that, then it definitely increases your chances of passing, as opposed to trying to do it on your own. I hope that makes sense to you guys. If you can't afford it, that's fine. You just have to be a little bit more dedicated, and you can still ace the Plab 2 exam. I hope I've been able to answer all your questions, guys. That is basically all I was able to come up with for how to study for the Plab 2 exam and how to pass the Plab 2 exam as an international medical graduate. Thank you guys so much for watching. I really do hope you enjoyed this video. Please don't forget to subscribe if you did enjoy the video, and give the video a massive thumbs up. Thank you guys so much for watching, and I will catch you guys in my next video. Bye guys.